to welcome you all to Peanuts Corner for the month of November. This is Dr. Iris Rosenfeld, and in honor of Diabetes Health Month, we are going to talk about the 10 must-know keys to diabetes prevention. As a doctor of chiropractic, we work on prevention. So let's talk about some statistics first. And I know maybe statistics isn't your favorite subject, but this will be a little bit alarming. Did you know that the average American eats 45 teaspoons of sugar per day? That 2/3 of Americans are overweight or obese? And that 1 in 4 Americans have type 2 diabetes. 30% of our children are overweight or obese. And millions of us, if we're not in diabetes yet, we are in insulin resistance or pre-diabetes. Diabetes can cause many serious health problems, including obesity, heart disease, and increased mortality. And it is the 5th deadliest disease in the United States. So how do you know if you're at risk for diabetes? Well, if you have a family history, you're overweight, high blood pressure, your cholesterol levels are up, you're over 45, and you may have had a history of gestational diabetes. Now, your medical doctor may recommend drug treatment. And is that really the answer? Does drugs or medications look to the underlying cause of the issue? Medications are poison to the enzymes in your body, and it changes the normal biochemical pathways. So use medications as your last resort, and I want you to think of diet and lifestyle modifications first. So let's begin by talking about the 10 real action steps every American should take. This is part 1 of 2. So we are going to go through the first 5 steps, and then on video 2, we will go through the last 6 through 10 steps. Step number 1. The first line treatment in blood sugar is to balance lifestyle modifications with weight loss and a healthy diet. A healthy diet consists of whole grains. You must avoid refined, processed foods. Moderate amounts of lean meat and fish and unsaturated type fats are good. Make sure you're eating small, frequent meals. Increase your fiber, and eat 2 servings of beans per day. You may want to add a few little drops of iodine to the beans to decrease gas. And high fructose corn syrup should be eliminated from your diet, as well as making sure that you check the glycemic index. Go online and check that, and watch your fructose levels to not be beyond 25 grams per day. Number 2, you should consider eating a vegetarian diet. You may want to consider an elimination or rotation diet for allergies, to detect to see if you have allergies. Make sure you do not decrease or eliminate an entire food category. That leads to many sugar imbalances. And make sure you do not severely restrict calories. Number 3, breakfast is an important meal. Remember what our moms told us, breakfast is the most important meal of the day. Why is that? When you get hungry, let's say you don't eat breakfast and you get hungry, what are you going to grab? A sugary snack, right? Like a muffin, for example, or a donut. What does that do? It spikes our blood sugar, and that causes insulin to be released from the pancreas. And when that happens, that pattern is repeated time and time again, your pancreas will wear out. And what happens then? Diabetes. Okay, number 4. There are numerous supplements and herbal products that we recommend to help in diabetes prevention. So check out my website for more information about that. And lastly, number 5, exercise. You hear that all the time, and it is vital. We usually recommend a goal of about 150 minutes per week. That will increase cell sensitivity to insulin, decrease fat, and very important, we want to make sure that maybe you work with somebody, find a workout plan that works for you with cardiovascular and anaerobic and aerobic activities. So, until video number 2, I think it's time for Peanut and I to say bye-bye, everybody, and please contact me, Dr. Iris Rosenfeld. My website is www.driris.com. My phone number, 949-380-7215, and my email is dr.iris@earthlink.net. Thank you for watching. Bye-bye.